The Aging with Options show is about seniors and for seniors and their loved ones. Our passion is to provide interesting, timely, relevant content for seniors and their families in the Louisville area. I'm Chris McCutcheon. Our topic is medication management today. My guest is Lynn Harrelson, a senior care pharmacist and owner of Senior Pharmacy Solutions. Lynn has been sharing some valuable information on the services she provides in the home to help seniors use their medications more wisely and the associated benefits of improving health and supporting independence and conserving resources for seniors. Lynn, give us a sense, if you would, the process that you go through with the medication therapy management services. Give me an idea, share some success stories and some of the outcomes that you've seen that have to make you feel good.
Well, one of the things I'm going to start out with is one of my drug detective stories. Okay. We had a patient lady, and she was having some problems, and we couldn't figure out what was exactly going on. Her list wasn't complete. We discovered that, but more importantly, I kept digging, and I found out that she wanted to please both daughters. One daughter thought that she should take one blood pressure medicine, and the other daughter felt that the other one was best, and Mom was taking both. And she was embarrassed or didn't want to tell the daughters that she didn't want to disappoint them by not deferring to one of them. She loved them equally, and she was taking the medicine that both of them felt was best. We got that straightened out, and she remained independent and healthy for what I think a much longer time. But I have two that I really hold near and dear to my heart. I was contacted to provide services for a senior, and she was falling 3 and 4 times a month. She'd been falling for almost a year to that extent. She had had extensive ER visits, follow-up checks, x-rays, MRIs as a result of her repeated falls. And someone suggested that her family contact me and ask me to review her medicines. I took my initial assessment of her 4.5 years ago. I've continued to work with her over the years, but in my initial assessment was 4.5 years ago. And that lady has not fallen once. Wow. Since we have decreased her medication. She had an opportunity to take over 30 medicines, and she's taking 10 now. It's still high, wow. But those are medicines that she needs and that she benefits from. And we still have to manage and make sure that the medicines that are introduced now continue to work well with her. My other success story is something that I really like, and it's only because it ended up with jewelry. I had a patient that came to me and had been diagnosed with dementia, declining memory, inability to just get through the day-to-day with what they call daily activities of daily function. Mm-hmm. One of the members in the family thought, well, let's just look at, before we send Mom to a center for memory, let's just look at her medicines. And I did that. I worked and reduced a number of medicines, changed how they were being dosed, and got several reduced. And about a year later, I got a phone call and was asked to come back to the senior's home. And I thought something was wrong with her, but they were nice. They just laughed and giggled. And the granddaughter had made me a little beaded necklace. And her comment, it was her grandmother's birthday. And I was invited to the birthday party, and I was given the gift. They gave me a little necklace, and the granddaughter said, I got my grandmother back. Wow. And that was a gift to me. It was.
Quite gratifying. That's fantastic. Now, fall risks is certainly a significant thing to be concerned about with when we're talking about multiple medications.
Yes. Falls are the number one reason that seniors end up leaving their primary residence. It's the number one reason that they go to the emergency room. It's the number one reason that they end up admitted into the hospital, have hip replacements or other broken bones. It is the number one reason they go into a nursing home, they lose their independence. The biggest risk factor for falls that can be managed and prevented are medications.
Wow. That's fascinating.
It is so significant in this state and many states across the country that they have action teams working on that specifically just to heighten the awareness of the implications that medications have in increasing risk.
Now, should a fall in and of itself give rise to concerns over the number or combination of medications that someone is taking?
Remember earlier I said if someone comes to you and they have a rash, as a healthcare provider, we think of a new medication. If someone has a fall, the red flags should go up. Medications, medications, medications. It maybe isn't just the medications. It may be how they're taking them. It may be that the patient's not taking enough fluid, but that complicates the medication use. But I'm going to say it again. Falls. Medications, medications, medications.
So always think medications when there's a fall involved.
But in reality, and I've worked in this senior market as a pharmacist for many, many years. And if I see someone change, someone have a problem, I'm always going to think medications first. It's just that it's a double-edged sword. We have many more sophisticated medications helping seniors and others live a longer, happier life. They just need to be managed well.
Right.
We don't need to eliminate everything. We just need to manage them to the correct level.
Right. Now, you've talked, Lynn, you've given us some good examples and some nice success stories that are heartwarming, and the benefits that you've been able to see played out in some of your patients. Now, some people listening may think, well, I'm taking a lot of medications, or a family member of mine has a lot of medications. Sounds like a good idea. Maybe we should evaluate the number of medications. They may be thinking, I could go to my pharmacist, local pharmacist, or maybe take my bag into the doctor and whatnot. But what you do is far different from that, right?
Far, far different. The reviews that you may get at a physician's office or a pharmacist, they're very, usually very short, brief. They're not maybe as comprehensive, and they don't have the long-term coaching planning phase where we follow up on any changes to see that indeed that the changes that are made are the outcomes that we want.
Very good. Excellent. Lynn Harrelson is my guest in the studio. Lynn is a senior care pharmacist and owner of Senior Pharmacy Solutions. We're talking about a very important topic today, medication management and counseling seniors on how to properly use their medications more wisely. We'll take a quick break and be back with the Aging with Options show and my guest, Lynn Harrelson, on 970 WGTK.